hello everyone. My name is Nicole Naumoff. Thank you for joining us again with our Fox Management Consulting ongoing pandemic series. I'm really pleased today to have Kevin Ruth, a Temple Owl, a proud alum, and most recently a senior executive at UnitedHealth Group. If you're not aware, UnitedHealth Group is the world's largest healthcare organization by revenue, with revenue of in excess of $242 billion in 2019. Kevin and I also have had the opportunity to work together with Fox Management Consulting. He was a client in one of my most recent sections, and we had our MBA teams working on strategies, looking at outpatient services and identifying how to get customers to use appropriate sites of service versus emergency rooms. Really exciting projects. And Kevin, I hope you would agree that their students did a good job coming up with some interesting strategies and solutions.
Oh, they definitely did. Yeah, they thought of things we never would have thought of.
That's usually the benefit with Fox Management Consulting. You get the outside look from our students. So today, Kevin, you're going to share some of your experience and insider perspective on healthcare costs, the financial impact of flu vaccine, and how that may relate or not to potentially having a COVID-19 vaccine in the works, and any other sort of healthcare implications of COVID-19. So I want to thank you for joining us again, and maybe you could just share a little bit about your experience at UnitedHealth Group, and we'll get started.
Okay, great. Well, I had a great 20-year career there and recently wrapped it up in January, and had experiences. I ran a dental company. I worked in a vision company. I was a local leader, a regional leader, a national leader, and a big Six Sigma guy. Also worked in our culture. So just had tons of opportunity and in all aspects of our business. So whether it's the consulting side or the Medicare side or the commercial side, probably little sprinkle of the community and state Medicaid program, but principally in the commercial and Medicare businesses. So got a chance to do a lot of things in my 20 years there.
Great. So that's actually going to be really helpful today because I think we've had some really good questions coming from the audience. But in preparation for today, Kevin, you and I discussed a little bit about the flu vaccine and sort of its impact financially in terms of at UnitedHealth Group, and perhaps you can sort of share sort of some insights around the flu vaccine and its sort of impact on healthcare costs.
Sure. Thanks for that, Nicole. And I want to just sort of caveat that I'm not looking to start any political debate about whether people believe in the flu or don't believe in the flu or think it's the one thing I will tell you is it's not exactly like COVID-19, but even that can start a big debate. What's interesting about the flu is it's about $10 billion a year is spent on the flu nationally against $3.5 trillion of total healthcare expense. So it's less than 1%. It's actually 0.3% of total healthcare costs. And when you hear people talk about it, you would think maybe the flu was a preponderance of healthcare costs or a big driver. And it does drive the expenses of an insurance plan and may cause a factor in pricing, but it's nowhere near the biggest line item in healthcare costs. So, and a lot of times people compare the flu to COVID-19, but there's so much we don't know about COVID-19 yet and what the actual costs are going to be. To me, it's not a fair comparison.
You said something when we were speaking earlier too about it that often, I don't know how to delicately say this, but perhaps the insurers sometimes also discuss the flu as sort of being a driver of costs as well.
Well, yeah, especially in the winter during the flu season, it can have a big impact on the financials positively or negatively during that cycle. And it's an easy explanation when you're sitting on an earnings call as to what's going on. And a lot of that depends on how effective was the vaccine, how vibrant is the flu that year, depending perhaps even on the weather. Did it mutate? It's getting more and more complex. The problem is when you compare that to COVID-19, we're still in our very first cycle of COVID-19. We don't really know how it's going to shake out. And the virus is causing an impact on other healthcare costs because people, either elective surgeries were shut down for a while and or people are just afraid to go to the hospital unless it's a real emergency because they don't want to get COVID.
And maybe you can speak a little bit to the costs associated to what we do know around COVID-19. I think we think about sort of the devastation to our economy, sort of in a macro sense, but perhaps you can sort of illuminate some of the costs from the hospitalization side of it for a COVID-19 patient as what you've been learning.
Sure. So again, when you think about the flu and the impact it can have, 12% of the population gets the flu, basically year over year. So that's 40 million cases. And we all know about the cases we're seeing in COVID-19. We went over 2 million cases just recently. On the flu, 2% of the population gets hospitalized. So that's about 800,000 people. For COVID-19, it's a much greater hospitalization rate. And the cost for a COVID-19 patient is much higher, can be as much as 15% higher. And most recently I heard about a gentleman was in the hospital for 67 days and came out with a bill of $1.1 million. I mean, it's just a brutal thing to be handed from a disease. There's nothing you can do. Well, there's lots of things you can do, wash your hands, that kind of thing. But, when you get it and you have a chronic disease and you end up in the hospital and on a respirator, 67 days later, you're getting handed a big bill. And I don't think that even included the physician costs. I think that was just the hospital costs.
And we do know that COVID-19 is, disproportionate in who it impacts. And you sort of were mentioning to me, which is interesting, is that because of that sort of issue of certain populations being more greatly impacted, elderly, things like that, that there's, definitely strains in terms of like Medicare and Medicare coverage. And could you maybe sort of illuminate on what you might see or foresee coming out of this?
Sure. So when I think about the impact, where the impact is from COVID-19, it's principally going to be in your Medicare population. So those 65 and older, 80% of the cases are that category. On the commercial side, a lot of the COVID expenses are being offset by costs that are not occurring right now. On the Medicare side, you have a lot more chronic disease. It's going to be a lot harder to, sort of have those costs be avoided. So, it's going to have a bigger impact in the Medicare space than in the commercial space. Although both the Medicare and the commercial business will attempt to price for the COVID-19 impact and get that into their trends. Trends is probably too much industry speak, with their price increase for next year.
And maybe could you illuminate on that? Because just as you said, help us sort of understand how, a UnitedHealth Group might go about looking at its coverage, its plans, changing plans and premiums due to COVID-19.
Yeah, I mean, as part of the build out on pricing for insurance products, you do your best. You see what transpired this year. You take a look at what you think your population is going to be next year, and you try to price it out accordingly. And pricing includes both increases from providers as well as anticipated utilization. So because a lot of people are talking about the second wave for COVID-19, but we haven't even completed a first wave of COVID-19. And the way we're going right now, it may just go right into the fall. We might not get a break, and all that has to be considered. And then the timing of the vaccine, and then will the vaccine work? And there's just a lot of questions out there. And then just as healthcare is being delivered, it's going to be delivered in a different way. And what's that going to cost? And so there's just a lot of question marks out there. And I know one of the things I was always proud about, UnitedHealth Group had a lot of really smart people that are going to figure this stuff out, and I'm confident that they still will, as will, the other payers.
So, we did that project together looking at appropriate sites of services. So maybe you could sort of speak to what you might think is going to happen with a lot of our health systems right now are actually filing for bankruptcy. You sort of mentioned the fact that there's the postponement of care, or the delay, or even the decision not to have care. Can you sort of illuminate on what you think that impact of these delays may have, and may even challenge how systems are even organized or even access to them?
Yeah, and this is my view, but I think that the impact of COVID-19 is not just on the patients, but also on the providers, in that some providers who do elective type surgeries have basically been put out of business. And so they either have to find another way to generate income, or they're going to be in trouble. And then, any provider that was sort of on the brink of bankruptcy to begin with, this didn't help. And so that, that's an issue too. I think a lot of things, not just in this industry, but in all industries, I believe it's going to move things more quickly than it otherwise would. So like retail, a lot of the retail that's going out of business, I'm not predicting they would have absolutely gone out of business, but we've been seeing them, go out of business or get in trouble. So I think it's going to move some of that along more quickly. And what I am excited about with all this is the innovation that I believe is going to come. I really believe that a lot of things that we've been dreaming about, I think, will start to happen, because healthcare has to be delivered in a different way. It can't continue to be delivered the way it is.
So it's interesting that you say that, because this has become just this recurring theme with all of our guests that we've had, is this concept of a compression of timelines on trends, or things that they were already sort of thinking about were happening, and sort of this pandemic has just, this was, say, true even back in 2008 as well, but there seems to be this sort of impact that once we come out of it, that there's sort of a development or a compression in something that they were seeing, strategically before. So maybe you could speak a little bit more to, I'm going to put you on the spot because you just mentioned it, but maybe you could speak a little bit more to sort of what kind of predictions you might have. I think I threw one out at you, like single payer. And so I'd love to hear what you think about the innovation side. Do you think there'll be even, fundamental structure changes or legislation that could come from the pandemic? So I'd love to get your insight there.
Yeah, so everybody thinks single payer is a good idea as long as they're the single payer. So we'll see how that all plays out. I actually think the private-public partnership for dealing with healthcare matters actually is a really good idea. The innovation that a company like UnitedHealth Group can bring to, the local, regional, and federal government, I think it makes a lot of sense. But a real life example, to answer your question more directly as I tap dance there, is the whole notion around telehealth and telemedicine. 15 years ago, when we first tried to introduce it, it was not accepted. The providers thought it would take from their revenue. And now the providers and patients, they just seem to love it. And it's a great way. It's a cleaner way to deliver care. If you have an emergency, you need to go to the ER if it's a real emergency. But if you're a mom and you need amoxicillin for your baby, maybe I'm showing my age, but why did my wife
give that out?
Why did my wife have to go in and have a baby sit with all the other sick babies and get what she knows she needed to get? And if you have a relationship with your physician, and now she wouldn't have to. She just get on telehealth and get the script, and you could even have that then delivered to your house. I think the whole notion of having things just brought to your home so you don't even have to go get it, I think that's going to go faster. So I think there's going to be a lot of innovation around this notion of telehealth and telemedicine. I think robotic surgery, where the physician, again, doesn't need to leave the house, can do the surgery from wherever they are in the world. I just, so I get really excited when I think about the innovation coming in front of us. And I mean, look what we're doing right now.
Right.
Until we were forced to do it, we probably wouldn't do this. And now that we're doing it, I'm like, hey, when I close this lid, I'm going to go play golf. Like that, you can't beat that, right?
No, I hear you. It's it is true, and actually, this was born out of the pandemic. Was the idea that we had something to offer from Fox Management Consulting, and access to leaders like yourself to provide some insights and give us some good challenges and food for thought on how to manage through this pandemic. So definitely appreciate that. And circling back to when we did our project together about appropriate sites of service, do you see that actually the situation helping sort of accelerate that use? Just as you said, telemedicine, I could imagine that people may not want to go near a hospital if they can help it, but do need to, say, have elective surgery.
Yeah, I think this is opening people's eyes to what's possible, whereas before, you kind of just do what you were used to or what your neighbor suggested or so forth. I think you're also more focused on the patient provider relationship. When you're looking at the screen, you're looking eyeball to eyeball. One of the biggest complaints from patients is they don't feel like their physicians are really paying attention or spending time with them. But with telemedicine, you kind of got to look at each other in the eye, or at least in the little green dot that I'm looking at, and spend the time together and feel like you're actually being heard. And I think that's going to be good for medicine. And so, yeah, it all depends how the vaccine works out, how fast it comes, how relaxed everybody gets. Do we go back to where we were, which is, I think, our natural tendency. We don't really want to change. And then do we, take charge of this innovation and really make some really cool stuff happen, which is what I'm voting for. And I think it'll make for higher quality. We spend more than any other country in the world, and we're number 35 in quality year after year after year. And that's what I think would be awesome if we could change that. If we're going to be number one in spend, we ought to be number one in quality as well. And
right. And, part of that quality issue is, another sort of major, conversation that's happening right now is with racial inequity. And we can sort of see how it's becoming evidence. We've known that there's inequity in our healthcare distribution and access as well. And do you foresee any sort of positives coming from that side of it as well? I know you've done a lot of work in that area.
Yeah, UnitedHealth Group puts out an annual report on that, and the disparity in healthcare based on demographic is real. And the COVID virus has just brought it out exponentially. And it's a serious issue that needs work. And I'm hoping that this isn't just a phase. I'm hoping that all the companies that have gotten involved, all the celebrities that are, throwing money in, I hope this movement keeps going so we can really make a difference, because that disparity is real, and this pressure on the healthcare system has just exploded it. And I think it's becoming more into everyone's awareness, which before I don't know if as many people really understood it.
Right. Yeah, we can see it.
Yeah.
Sometimes you have to be able to see something to believe it too, right? Or to understand it.